So I finished up clinic early and I decided to go work out real quick. And what I wanted to talk about, I was thinking about this when I was working out, and I actually had two patients today that came in to see me with fatigue. When you work out late, as I explained in my previous videos, be careful that you finish your workout routine, no matter if it's cardio or weight training, slow and steady, or high intensity interval training. I would always say if you're working out after dinner and you want to get good sleep, finish your workout routine with a breath exercise and slow movement. It'll bring out a serotonin response. It'll kind of negate or neutralize that adrenaline and endorphin rush that you got, and it'll set the brain up for proper sleep. Remember, the brain goes through, if you watch my lecture that I give at Whole Foods, I'll put a link here, the brain goes through different brain waves of sleep. When we talk during the day, it's something called beta wave, and then when you start to get sleepy, it's alpha, and it starts to go down into lower intervals and lower frequencies. Well, once you get into that great frequency, whether it's with valerian and hops or just relaxing and doing the pointers that I mentioned in my lecture, you'll dump into stage 1, stage 2, stage 3 REM. The more REM you have in a night, the deeper the rest is. And for those of you who suffer from chronic fatigue or just plain old fatigue, you know that even if you sleep 6 to 8 hours, if you wake up unrestored or unrefreshed, that usually means that your sleep was terrible. Some patients have been given medicines like trazodone or Xanax or clonazepam, sometimes even Benadryl. They'll take it on their own, and just to get to sleep, thinking that if you get sleep, the formula is you'll wake up more refreshed. But those medicines work temporarily to nudge you into sleep, but they also rob you of REM. Again, if you have, the studies show that if you have deeper cycles of REM, 6 to 7 in a night, and they're good and long, then your brain will be refreshed. That's what the brain needs. It needs rest and relaxation. When the brain is rested, it can tolerate the problems of the next day or the schedules of the next day, and it'll problem solve faster. It'll be more emotionally stable. It'll tolerate pains and trigger points more readily. With chronic fatigue, well, it used to be called chronic fatigue syndrome back in the 90s. The Center for Disease Control, the CDC, came up with that diagnosis. But unfortunately, since the 90s, 94, 95, I started working in 95 as a physician, and we just kind of broke into the diagnosis of fibromyalgia syndrome, or FMS. And I had sports medicine as my training in addition to primary care. I was pretty good with the fibromyalgia patients, at least as far as applying manual therapy, manual medicine, musculoskeletal medicine, and that, even though I didn't have my nutrition and my integrated medicine training, I still was able to give them a little bit more help than the average doc. Now that I have other things under my wing, I think that it comes in perfect timing, because the diagnosis by the IOM, the Institute of Medicine, is now called Systemic Exertional Intolerance Disease. So there's actually a disease process. And I think it was made because, number one, patients, when they go to doctors and they get what's called a runaround, they get a whole bunch of tests done, and there's nothing that comes up positive, no mono, no Lyme disease, no thyroid problems, no candida, not that we have great tests for candida, but no candida, and there's nothing that's really found bad. Usually the doctor, if they can't find anything, they just say, well, you might have a little depression, so take this medicine and you'll get better. But those of you who suffer from fatigue, you know that that's not the case. There might even be bowel issues. There might even be this hypersensitivity you get. There definitely is a lot of trigger points. And the problem I see is when patients try to get better on their own, they'll try remedies to knock their sleep into submission and try to get a good night's sleep. And those usually work temporarily or half-ass. I like valerian with hops, I like passion flower, I like aromatherapy. I like those pointers that I put in my sleep videos to take care of calming the 5 senses, at least setting the environment for good sleep. But if you have chronic fatigue, or if you have those symptoms of fatigue during the day, usually you're so wired and tired that you can't get to sleep. That's why I mentioned about the exercise. If I go to sleep right after exercise, if I eat all this stuff right after exercise, even though it's clean and green, I've just stimulated my gut to start digestive enzymes and have a lot of acid churning. That's not the proper thing for sleep. If you watch my reflux video, that's a setup for reflux. So I don't want to eat too much. That's why I don't want to exercise too late. But I just happen to find the time today. I usually hydrate right afterward. There's a rule that I have for hydrating when you're exercising or hiking or doing anything where you're sweating out, detoxing, yoga. But if you rehydrate too much, you'll be peeing all night. So you have to be careful as the pump from the muscles start to shift back into the fluid going back into the blood vessel system. So interrupting sleep, not a good thing. Exercise is a good thing, but you have to be careful if you have that systemic exertional intolerance disease or chronic fatigue syndrome or fibromyalgia, whatever you want to call it. If you're fatigued, you got to be real careful about stimulating exercise during the day, because if you overdo it with the knowledge base of trying to exercise and use the exercise routines from college days or high school days, probably won't work as you turn 30, 40, 50, especially if you've suffered for more than 6 months. Your muscles won't tolerate it. So you have to be careful. Your brain will probably say, okay, I can do this. I used to do this back in high school. And then when you get kind of pumped up because you see other young people exercising in the gym, you push things too far, you'll have delayed onset muscle soreness that won't go away for a week. And there you go. You messed up because you're in so much pain. You have to take a pain medicine. You have to deal with the discomfort when you're rocking and rolling in bed. It just sets up for an injury. So those of you who suffer from any kind of fatigue, you know you can't push the envelope. You've probably tried already, but you have to be very careful, and that's what we found with that systemic exertional intolerance disease. The SEEDS disease is that you usually will not be able to tolerate what you did before. You'll usually not be able to function like you did before. You usually will not have restorative sleep. You usually have some form of a psychological illness too, and no question, if you suffer from any disease or you're having pain for more than 6 months, anybody, even the most stoic people, guys especially, will not be emotionally stable at that point in time. You'll be very emotional, you'll be very teary-eyed, you'll be very irritable, off the handle. You'll almost have symptoms like the hot flashes and or menopause or manopause, yet you're not going through that with the blood tests. There are certain blood tests that most primary care docs and specialists will get to rule out big diseases. Like I mentioned, mono, Lyme disease. We'll look into psychology as far as, well, what happened before when you were younger, see if that's coming out now. Sometimes when you're fatigued, small traumas from when you were a kid will blossom again. Or if you didn't resolve things as you're in your early 20s, 30s, they'll be quiet until you have this chronic fatigue problem, or the fatigue will flare up again. Then those things that weren't resolved will come out again. So it's important to rule out psychological illness. It's also important to rule out thyroid disease, irritable bowel syndrome, problems with other forms of neuropathy, headaches. It's always important to look into those things. Sometimes with that brain fog that people have with having so much fatigue, it is important to look for magnesium deficiency, vitamin D, any kind of vitamin deficiency, because usually because of the fatigue, you're searching for food, which is the easiest thing that you would think about, food that will give you comfort. And usually the food that gives you comfort, especially when you're in brain fog, will be bad choices. You're not going to think about eating healthy. You're going to think about eating something that smells sugary, high salt, kind of yummy texture, which is usually fast and processed food, which usually will give you a little bit of a high, short-term stimulation to certain parts of the brain, but then you crash because of the amount of insulin that's released to put that stuff away and protect your cells. Well, the insulin will get released at that time within 30 minutes, and then you'll dump. It's called the glycemic index, the insulin dump. And then you'll feel crappy again, more fatigued, and then you'll want to search for more fast, short-term rewards. Usually bad idea. That's why it is important, like I used to do with my folks back in the 90s, it is important to get a coach. Back then, because I was sports medicine dominant, I usually would get physical therapy, massage therapy, acupuncture involved. Now I get all those manual therapists, the hands-on healers, in addition to coaches, like with counseling or psychology as far as CBT, cognitive behavioral therapy, meditation teaching. Sometimes mindfulness-based stress response is also a fantastic thing for anybody that's suffering. But it does take getting to a coach, and a lot of people still have apprehension about going to a psychologist, a counselor, a pastor, or even a social worker. There's a stigmata still, and I usually will say, you know what, at the least, those guys will be able to devise a relaxation program for you. I mean, you can watch my videos on 4-7-8 breath, breath to linking breath to movement. You can watch all that stuff, nature therapy, but it still takes a coach to make sure you're on target. Because if you are fatigued already, it's going to be even harder when you're fatigued to keep on target, keep on a goal, keep on the calendar deadlines because you're so fatigued. The brain fog will make it hard, and when you're trying to figure out the schedule, the brain fog will get you so frustrated that it'll bring you more anguish. So a psychological coach or behavioral health coach, in addition to what I mentioned, a musculoskeletal coach. Then I like to have a nutrition coach. Unfortunately, it's hard to find good nutritionists. We have a big sector of the ancillary care and health care going into nutrition and body or health coaching, and I think that's really great. Going to a registered dietitian is very powerful, but I've unfortunately heard a lot of backlash from patients that I send for diabetes care, and some of them say, well, I already knew most of this stuff, but I think it is because in the insurance world, if you're in medicine, whether you're a registered dietitian or a doctor, you really are truncated to give as much information in a short amount of time as possible. That's very frustrating. So sometimes paying out of pocket to see a registered dietitian, a nutritionist, somebody that's involved with health coaching would probably be a good idea. And they can keep an eye on you. Sometimes personal trainers do that. Sometimes some great chiropractors will also do that. There are some blood tests you can get, allergy tests you can get, cortisol, saliva tests from DrRic you can get. SpectraCell has a wide variety of other blood tests that you can take advantage of. Depends on how much you want to spend. If your insurance covers some basic things, I do them. But just to rule out any big diseases, I don't usually prod any further because it still takes changing your sleep habit, and it is tough to do that. But usually if you give yourself at least 3 weeks, I like to rock the circadian rhythm back into submission. And that usually means a regimented, it sounds very black and white and very concrete, but I think it's the lowest hanging fruit. If you regiment your daytime to be mostly awake, eat during the day mostly high protein meals because it causes less of an insulin dump, more frequent too, not too high in volume, and then you save your high carbohydrate portions for nighttime, that'll give you that little bit of an insulin dump. You still have to keep it clean and green, small portions, a lot of hydration, and then probably some supplements. I think there are useful supplements. I talked to a vet the other day, and I mentioned about, because of a relative going through cancer, I said, hey, there's a great book by Keith Block. He's an integrative oncologist out in Evanston. And immediately the vet said that he has reservations on those nutraceuticals. And I buy that. I mean, sometimes you get talking to somebody who's in one of those multi-level marketing things, and I used to be that way too, but it sounds like they're probably just trying to sell you more and more supplements. Truthfully, most Americans are deficient, and I do think it will help with causing less side effects, but it'll help you with being more wakeful with rhodiola or ginseng, also being more sleepy at night. Valerian, lemon balm, hops, passion flower, 5-HTP. There's a lot of ways to manipulate things, also in addition to taking care of body aches. I think SAMe is great. I think proper magnesium dosing is great. I think turmeric is great. All these things have very little side effect versus some of the medicines that are commonly used for chronic fatigue, for sleep disorder, for fibromyalgia. Usually the medicines that get patients to tolerate the diseases or the symptoms of those diseases I just mentioned, the medicines also have heavy side effects that make the disease worse. Dry mouth, more brain fog, sleepiness during the day, problems with irritability of bowels. You don't want to flare that up, but so I think that supplements are great, but you also have to have an endpoint. You have to have an endpoint to when you can jump into the next activity that'll push a little harder without crashing. Remember, exertional intolerance, you have to be careful. That's why you need a coach. You also have to have an endpoint for when you taper off the supplements. You have to have an endpoint for when you taper off the prescription medicines. I'm not saying prescription medicines are bad. I think they're very useful, but it has to be templated for the individual. Not every patient that has fatigue needs the whole workup or needs a whole bunch of medicines. It depends on the person. I have a paramedic that came in, really good weight. He's keeping a good body weight, body mass index is right, but I think he's pushing the envelope a little bit. And then he and his wife are preparing for a kid, and that's stressful. If you're in midlife and you're ready for the kid, you're kind of prepping the house, you want to get everything right. you also don't want to lose a love, and that's a lot of stress when you're working 50 hours a week, especially my firefighters. I mean, they're dedicating themselves to saving lives and then turning it off and trying to get a good night's rest. And same thing with the police officers. I adore I take care of my police officers, my firefighters, my paramedics, my teachers, but they're also the sleep cycle is so bad that some folks are just, I feel it's so bad for them. But bottom line is, not everybody gets the same templated treatment plan. So it has to be personalized. You have to design, again, you have to get those coaches. I have to get those coaches because they'll be my eyes in the field. Be able to get somebody for a relaxation practice, somebody for a nutrition practice, somebody for movement and activity. If you get everything together, I know it is an investment, and then supplements to take care of band-aiding some of the symptoms, you'll actually move yourself towards a goal. And if you move towards the goal of quieting down the fatigue, improving the sleep, improving the restoration and the relief of feeling energized in the morning, getting rid of the naps, getting more muscle bulk, you'll actually reverse the disease process. It'll take a lot of movement, and sometimes you'll kind of fall through the cracks. One thing will flare up, another thing will flare up. Again, I like the words that they use, that the IOM came up with systemic exertional intolerance disease, because if you've ever been through it, any kind of fatigue, whatever you want to call it, you know that you can only tolerate so much of a little feast, but you'll pay for it the next day. So much of a little bit of exertion, or walking the beach farther than you thought, you'll pay for it 2 days later. And it won't be just the standard turnaround time, it'll be a long turnaround time. So you have to be very careful about temporizing your introduction, but still having a goal. So hopefully, again, everything moves you to the right direction of healing so that you can be returning back into wholeness would be what I suggest.